Hi, it's Dr. Frey. We're going to do cervical rehab. So that, everybody knows core rehab for lumbar. How about the top end of the spine? The way we're going to stabilize these support muscles is, I recommend doing this first thing in the morning. You can either do it in bed or you can roll onto the floor, and we're going to use various aids to help us arrange this. And these are just normal hand towels folded in quarters, and that's going to be our base. Say you just woke up in the morning, so we're going to follow. This is your sun salutation, if you will, your early morning warm up, and you'll be on your back, and of course you were probably using a similar, either a cervical pillow or a similar towel roll under your neck for the proper contour this direction, the cervical lordosis. Now we're going to take that towel, flatten it out with another towel, have it under your head, and I'd like you to initiate this movement by tucking the chin before you lift. Now we're going to lift. It's like a mini crunch. So for the top part of your spine, don't worry about the lower spine. And then when you get here, you're going to push the head into the towels, and you'll arch up a little bit, not a lot, and you can press with the elbows a little bit into the bed or the floor, and then neutral again. So the air goes out as you tuck the chin and lift, and then comes in. So the lungs and the chest are expanding while you're pushing back this way. You'll do about 4 of those. Great for migraines, by the way. Stabilize the spine to prevent migraines. So now we'll do it on the side. We will tilt the head up. So you're using the top muscles, and then we bring the head down. And then we're going to push down into the towel, and we come to neutral. Raise up and push down. Now the third time, you're going to maybe help out just a little stretch, like so. Very gentle. And then pushing down. You'll do that 4 times. You'll do it 4 times the other direction. And then we do it forehead to the towel, like so. So we're lifting and contacting the forehead. Tuck the chin first. Arrange this so it's not pressing on your eyes too much, but you are going to feel a little pressure on the forehead. Push and down. Quite simple. You won't, in watching that happen, you say, what possible good could that do? You will feel what the difference is when you try it, how the muscles that support your head and neck in a lengthwise fashion engage when you do this. And now we're going to add in a foam roll. This is a regular 6-inch foam roll. I just chopped off the end of a 3-foot one so it's easier to handle. And we'll use this on your side. You're going to, so this is phase 2. You wouldn't necessarily do this every day. You tuck it in all the way to your shoulder and let the top of your head stretch out over the foam roll. And then we're going to gently stretch here. And so it's lengthening over the foam roll. And you may feel this cervical spine adjust, or you may get a little crepitation, a little sounds there. And then you'll come down and put it just above your ear. Kind of have to fold down your ear to top of your ear to get it out of the way. And then Now you're going to let the neck kind of bow in this way, gently, a little pressure from the top, and roll up here. If any of this bothers you, don't continue and tell your chiropractor. Gently here, raising up. Same thing on the other side and in the back. Gently here. Rolling up. Here. And then the other one I want to share with you is the famous to eat tennis balls, or these happen to be soft balls, which are pretty hard, but they're larger than a tennis ball, and they're tied into the toe of a sock so that they stay one next to the other. And this is similar to a Ma roller, if you've seen these wooden things that look like a dumbbell. And this is contacting on either side of the base of the skull. The headache people are going to find these points a little bit tender. You'll hunt by rolling around on the ball until you get to the tender spot. You might have to roll down so it's on the actual back of your cranium. Slowly just feel those points. When you get to a tender one, stop and breathe and just let that pressure release the, you may be on a trigger point, you may be on an acupuncture point, it doesn't matter. If you feel it, then it's a sign that your central nervous system needs to get the message from that place. You'll roll down to the next place, and down a little further. And you can actually take this down into your spine as you go. On the floor, of course, it's going to be a little firmer pressure against your spine. You're on either side of the spine, not on the spinous processes, but just on either side. I found a tender spot, so I'm just going to let the muscle self-massage and release spasm, release tension at any place along the spine. And you can use this as far down the spine all the way to the sacrum and the piriformis muscles on the bottom. That's the conclusion of cervical rehab.